Our mission is to fill the world with highly skilled spiritual caregivers. At VCU, advanced education is designed to further enlighten those men and women whose purpose in life is to ease the heart's pain and comfort the grieving soul.
Part of our education starts with what they require for us. That includes, in one semester, that includes that our students do a minimum of 300 clinical hours in the hospital and a minimum of 100 education hours in the classroom. So within one semester, students complete a minimum 400 hours.
I feel like I'm going to be very well prepared. It's a level 1 trauma center, so we get very high acuity patients. Unfortunately, that exposes us to a lot of tragedy, but the benefit of that is that these are real experiences that people are going through and struggling through. And of course, our role as chaplains is to provide emotional and spiritual support in that sort of broad spectrum of experiences, from the person who might be here for a minor surgery to the family who just had a loved one unexpectedly die in an automobile accident. I mean, we cover that spectrum, and this is a great place for really having that broad spectrum of experiences and encounters with people.
And I think, to echo that, it's really going to prepare me well, because in one shift, since we'll cover the whole hospital, you see everything. So you could get a call to the emergency department, turn right around, and you're going to neonatal to comfort a completely different family. And there's not a lot of rest time, so that gets you thinking on your feet, prepares you for handling pretty much everything. We joke that we're always surprised, and then we say, oh, we won't get surprised again, and then the next shift, something else you learn. So
we are one of 11 chaplain programs in this country that do research, that do serious research and research literacy. And so when you think about best practices and evidence-based medicine, well, we want to do evidence-based practice as well for pastoral care. How do you know it works? What are the things that you want to look for to say that I think this worked? We started out maybe 10 or 15 years ago looking at organ donation work, research. If a chaplain was present, would the donor's family consent for donation? And we found that the donation rates were higher when you had a chaplain that was with that family the entire time.
Our motto is head, heart, and soul, making it real through clinical pastoral education. Our goal is to challenge the mind, to reach the heart, to transform the soul through clinical pastoral education.